Hey, Dr. Matt here. Today I was asked, why don't you do iron infusions anymore? And the reason is, I really don't need to anymore. Iron infusions used to be a common part of our practice. I used to give Venifer, which is iron sucrose injection. And, I found that it just took so much time, so much energy from staff, myself, overhead. It cost, so much for the patients, anywhere from, it can cost from $800 to $3,500 for an iron infusion, depending on where you're getting it and what type they're using, what brand name they're using. So iron infusions, they do have a role to play, and I would use them if necessary. But this is actually November 20th. It's not even, I can't even use it anymore. It's out of date. It's been that long since I've done an iron infusion. It's actually been longer. It's been over 3 years now, because there are plenty of side effects related to iron infusions. And the main reasons usually iron infusions are used is because patients can't get their levels up via oral supplementation. And since now, I've had no problem with this new type of whole protein iron getting patients' levels up in an extremely fast manner. In fact, I noticed a comment on my page the other day, somebody saying, hey, they were taking a particular type of iron that had 36 milligrams of elemental iron per capsule, and they were being told by their doctor to take 2 of those twice per day, which puts you at over 100 milligrams of iron a day, elemental iron, which is definitely going to be irritating, especially when their levels are hardly going up. The same patient, they were hoping to have their levels up, but the doctor told them that it's probably going to take a few months, maybe a year to get your levels up. And so that's a lot of iron that's got to go someplace, and it's not going where you want it to go if you're having to take over 100 milligrams a day for a long period of time to try to get your iron up. Not to mention, you don't want to take iron twice a day, because if you take it twice a day, like I've talked about before, this protein goes up in the liver called hepcidin, and it makes it so that you stop absorbing iron. Your body literally turns off the signal for iron absorption. So got to be really careful with that. But back to the iron infusions. Yeah, iron infusions, like I said, they have their role, but I would suggest looking for other routes whenever possible. I've seen patients with, hemoglobin and hematocrits that they've been recommended to get iron infusions, but they don't want to do that. And so they came here and, literally within a month, their hemoglobin and hematocrits are completely normalized. Their ferritin has gone up multiple times over, from single digits like 1, 2, 3 ferritin up to 17, 18, 19, 20, 23, 29 in a very, very short amount of time. And of course, symptomatically, they're feeling like $1 million, which is what we want to see, right? That is the main thing. Let's get people feeling better in a hurry. And that's one of the big downsides of oral iron supplementation is people think, man, it's gonna take forever to get my levels up, and so people are going, let's go get the iron infusion, get the iron infusion. But iron infusions, they increase weight, they increase insulin resistance, because you're having this bolus of iron hitting the bloodstream, which is causing a lot of oxidative stress. They show that it causes lipid peroxidation, breakdown in cell membrane integrity, the inner lining of the endothelial of your blood vessels, the endothelial lining, the inner lining, being irritated and aged by even just one time per year of a bolus iron infusion in people who have kidney diseases. It can be pretty dramatic, the effects on that inner endothelial lining of your arteries. So even carotid artery intima thickness is increased by iron boluses via iron infusions. So it's not my first anymore. I definitely used to use them, but now that we have a exceptional way to get iron in very, very efficiently with just super low doses, like 30 milligrams of elemental iron in a whole rice protein matrix, and levels are going up like crazy, from 7 to 21, from 9 to 23 just in like 30 days. It's I know it's kind of mind-boggling. It was to me too when I first started about 3.5 years ago using this type of iron, but it's made all the difference. And now, like I said, we don't even do iron infusions anymore, because we haven't needed to, and before we thought we needed to, because we couldn't get iron levels up via oral supplementation, and then just the side effects from oral supplementation. But now we're seeing that, geez, not only can we get iron levels up via oral supplementation, but we can get them up and not have to have all the side effects and nausea, constipation, bloating, and just that dysbiosis and digestive distress associated with standard irons. So if you're looking at iron infusions, I think you can look elsewhere. I don't think you need to get an iron infusion. Maybe you do. Maybe you are in acute blood loss and got to have iron infusion. But majority of people really consider: do I need an iron infusion? Where is your hemoglobin, your hematocrit levels? Are they in a range that is literally like you are in acute? Like if you don't do something today or tomorrow, life is going to be really rough, or you're going to be having a heart attack or something like that because of low iron levels. Otherwise, I would definitely look into using a whole rice protein matrix chelated iron so that you can get your levels up fast, efficiently, without potentially any of the downside, both physically and financially, related to iron infusions. And just the time, got to be at the doctor's office, got an appointment versus you take 2 pills in the morning and carry on with life. With an oral iron supplement that works. So any questions, comments, please leave them below. Smash the like button, and I'll happy to answer any that you guys put down there. Talk to you later. Dr. Matt here.